Hello viewers, in this video I will demonstrate how I had prepared for Occupational English Test or OET. OET is very important to prove that you're proficient in the English language, and without proving that you're proficient in the English language you will not get registration with the General Medical Council, and without registration with the General Medical Council you cannot move to the United Kingdom to work as a doctor. So without further ado, let me demonstrate how I had prepared for Occupational English Test. So the first thing I did was I googled OET, and as you can see, the very first result is the official website of OET, but we will go to the second result where we can see that OET is the leading English test for healthcare professionals. Let's go to the official website and we can navigate the website from there. So this website is not just useful to tell us about what the test is, but it also provides various preparation resources. So as you can see here, why do you choose OET? Because it's designed specifically for healthcare professionals. It is accepted worldwide, but I would ask you to check with your regulator whether OET is accepted where you are trying to move. It is certainly accepted by the GMC. So we will go directly to the preparation resources. Before we go there, let's look a bit at the OET test. Okay, so what is the OET test? So you can learn more about the test here, and you can book the test directly from here. So this is a one-stop website. In this website you can find information regarding what the test is all about, how to book the test, and how to prepare for it. So let's find out about the test. Now OET test has versions for 12 healthcare professions. All healthcare professions are described here. You can see all of them here. There is OET on paper and there is OET on computer. I had taken the OET on computer. The advantage with OET on computer, of course there is OET at home also, but I had not found this as an option for me. The advantage with OET on computer is that you can schedule the speaking part of the test on a different date, and here you have descriptions of each subtest. There is listening subtest, reading, writing and speaking. So let's look at each one of them. Let's start with listening. The listening subtest is approximately 40 minutes long. There are 3 parts and a total of 42 question items. The topics are of generic healthcare interest and accessible to all candidates across all professions. Basically what this means is the listening and reading part of the test, they are common for all the 12 professions that are described here. So all 12 of these professions will have the same questions in listening and reading. Writing and speaking becomes different for different professions. Now, the structure of the listening test is there is part A, part B and part C. Part A consists of consultation extracts, about 5 minutes each. Listen to 2 recorded health professional patient consultations. So basically it's the consultation between a patient and a health professional, and complete the health professional's notes using the information you hear. So mostly the information will be delivered by the patient. I have made a video where I have solved the listening subtest live. You will probably benefit by watching that video, but you can solve your own videos. It will be helpful. Part B is short workplace extracts. Listen to 6 recorded extracts and answer 1 multiple choice question for each extract. And part C is a presentation or interview extracts. Listen to 2 different extracts and answer 6 multiple choice questions for each extract. Now this subtest is designed to evaluate a range of skills such as identifying specific information, detail, gist, opinion or the speaker's purpose, which are assessed through note completion tasks and multiple choice questions. Answers for OET listening part A are double marked by qualified assessors against an established marking guide. Answers for part B and part C are computer scanned and automatically scored. Now you can find more resources to prepare. See, just by clicking on prepare, we went here, and there are sample tests available here. Sample tests for listening, writing, reading, all of that. So we move back to the original part and we go to the reading section. Reading subtest consists of 3 parts with 42 questions in total. This subtest takes 60 minutes to complete. Topics are of generic healthcare interest, and accessible to candidates across all professions. Part A is about expeditious reading, that is speed reading. Read 4 short texts related to a single healthcare topic and answer 20 matching, sentence completion, and short answer questions. Part B is short workplace extracts, again just comprehension. Part C is a longer article, and again I have made videos where I have solved these sample tests in real time. This subtest is designed to evaluate a range of skills such as skimming and scanning, identifying the detail, gist, main point, explicit or implied meaning, as well as the attitude or opinion of texts, which are assessed through matching, sentence completion, short answer or multiple choice questions. Again, these are double marked by qualified assessors. You can prepare just by clicking here. So as I said, the OET official website is not just helpful in telling you about the test, but it also tells you how it is marked, and it also tells you how to prepare for it. It also provides resources to prepare for it. This is a speaking subtest which takes 20 minutes, and you have to talk to. There are 2 role play tasks for each profession based on typical workplace situations. In each role play, the candidate takes the role of the professional, for example, a nurse or a pharmacist, while the interlocutor takes the role of a patient, a client, or a patient's relative or carer. Okay. For veterinary science, the interlocutor takes the role of the animal's owner or carer. Structure of speaking subtest is the task is 2 role plays. Before beginning the assessment, there is a short warm-up conversation. This conversation is very helpful because it helps you understand the accent of the interlocutor. For each role play, there are 3 minutes to read the role play card and 5 minutes to role play the task points. The candidate and interlocutor role cards contain the same background information about the role play scenario and prompts to maintain the conversation for 5 minutes. It's very important to continue speaking for 5 minutes. You cannot finish before 5 minutes. If you do finish before 5 minutes, it indicates that you have not spoken properly. If you can't finish in 5 minutes, then maybe you've been speaking too much. So it is something which requires practice. The speaking subtest is and designed to evaluate 4 linguistic criteria and 5 clinical communication criteria, which again will be illustrated there. Role plays are recorded by the interlocutor, and these recordings are double marked by qualified assessors using the assessment criteria. The interlocutor plays no role in assessment. Very important. The interlocutor may give you glowing feedback, but that feedback is only good for your confidence. The assessment is made by different people, not the interlocutor, the person you're talking to. So let's read about the 4 linguistic criteria and the 5 clinical communication criteria here. So this may seem very overwhelming because it certainly is. The linguistic criteria talks about intelligibility, fluency, appropriateness of language, and resources of grammar and expression. Intelligibility basically means that what you are speaking is easily understood by the person who is listening to you. So you get the top score if your pronunciation is easily understood and prosodic features like stress, intonation, rhythm are used effectively. L1 accent has no effect on intelligibility. Basically, your indigenous accent has no effect on the ability of the person listening to you to understand you. Fluency, the top grade you get if your speech is completely fluent at normal speed. Any hesitation that you demonstrate is appropriate, and it is not a sign of you searching for words or structures. Appropriateness of language, again, if your language is entirely appropriate with the right register, the right tone, and the right lexis for the context. If you don't know what lexis is, we will check it. No difficulty at all in explaining technical matters in lay terms. So let's go to the meaning of lexis in case you don't know. Lexis Lexis is a term that refers to the vocabulary of a language. It includes all the words of a language in addition to the way those words can be combined in a specific language. The Greek root of the word means speech or word. So let's go back to where we were. Appropriateness of language. Entirely appropriate register, tone and lexis for the context. No difficulty at all in explaining technical matters in lay terms. Resources of grammar and expression is the fourth linguistic criteria. The grammar and expression should be rich and flexible. Wide range of grammar and vocabulary used accurately and flexibly. Confident use of idiomatic speech. Idiomatic speech is as fit as a fiddle, or he was a lion in the battle, or again this pause here is not appropriate because I'm searching for idioms. So any pause in your speech should be appropriate. It should not be a sign that you're looking for the right words or the right structure. But the important point here is I have only highlighted the top band score. You don't need to get the top band score, you only need B grade. So even if your speech is at number 5 level, 5th band, easily understood, communication is not impeded by a few pronunciation or prosodic errors and or noticeable accent, it doesn't really matter. Okay, now let's move on to clinical communication criteria. You don't need to memorize these criteria, but you just need to know what are the things to watch out for. For example, you should not have inappropriate pauses. You should definitely try to emphasize or stress upon certain words or certain parts of certain words, because that is how native English speakers speak English. Let's move on to clinical communication criteria. Now here we have 5 criteria. There is relationship building. We can see here relationship building, understanding and incorporating the patient's perspective, providing structure, information gathering and information giving. Now what is relationship building? Relationship building, the top grade you get is, that is A1, is if you initiate the interaction appropriately, such as you use the right greeting, right introductions, and the nature of interview is of the right nature. Okay, moving on to understanding and incorporating the patient's perspective, eliciting and exploring the patient's ideas or concerns or expectations. So you have to create a situation where the patient is comfortable sharing their ideas, concerns and expectations. Indicators of providing structure, sequencing the interview purposefully and logically, signposting changes in topic, using organizing techniques and explanations. Okay, so while I have only talked about the one thing, each aspect of it is important. So in relationship building you had A1, A2, A3, A4, all 4 you need to know. Like you have to initiate the interaction appropriately, you have to demonstrate an attentive and respectful attitude, you have to adopt a non-judgmental approach, and you have to show empathy for feelings, predicament or emotional state of the patient. In understanding and incorporating the patient's perspective, you have to elicit and explore the patient's ideas, concerns or expectations, pick up the patient's cues. For example, if they are feeling nervous about certain issue, please probe appropriately to understand exactly what they are nervous about. If they are sad about a certain thing, you have to empathize with the patient. You can't just brush it under the carpet. And you have to in relating explanations to elicited ideas, concerns and expectations. This is also important. Indicators of providing structure, sequencing the interview purposefully and logically. So you can start off by saying, first I will ask you a few questions and then I'll tell you what I think is the right approach towards treatment of this condition. Signposting changes in topic, you can telegraph the change in topic. You can say things like, let's move on to the things you can do to prevent this from happening in the future. And you have to use organizing techniques in explanations. Indicators for information gathering, facilitating the patient's narrative with active listening techniques, minimizing interruption. You should not interrupt the patient while they are telling you something. Using initially open questions, appropriately moving to closed questions. So the first question can be, tell me more about how you feel, and then maybe you can move on to, how long have you been feeling this way? Not using compound questions or leading questions. You should not ask double questions like, do you have any regurgitation or heartburn? And the patient says no. Did the patient say no to regurgitation, or did the patient say no to heartburn? Or has your heartburn gone away? Isn't your heartburn has gone away, isn't it? That's a leading question. You should not ask such questions. Clarifying statements which are vague or need amplification, you have to seek clarification from the patient if they say something which is vague, and you have to summarize the information to encourage correction or invite further information. So once you've received all the information from the patient, you should summarize it to encourage the patient to tell you more about what they should be telling you, or if you have said something incorrectly, they should feel comfortable in correcting you. Next, the final thing is information giving. This is the information you will give to the patient or the carer. First criteria here is establishing initially what the patient already knows. So there's no point telling the patient what they already know. Pausing periodically when giving information, using the response to guide next steps and also to check understanding. Encouraging the patient to contribute reactions or feelings. It should not be a monologue where you're going on giving information. You should definitely encourage the patient to interrupt you, but you should not interrupt the patient. Checking whether the patient has understood the information you are giving and discovering what further information the patient needs. So these are the criteria. These are the clinical communication criteria and the linguistic criteria in the speaking subtest of OET. Now when you go through the criteria, it appears to be very difficult. It actually isn't. The simplest way of doing well in the speaking subtest is to be relaxed. You will have all the prompts in front of you, what you're supposed to talk about, and as long as you talk about the issues that you're supposed to talk about in a normal, unhurried fashion without pausing too much, you will be fine. So let's move back to the writing subtest, which is the most difficult subtest according to popular opinion. Now writing subtest takes 45 minutes and is profession specific. So again, it is different for each of the 12 healthcare professions. There is one task set for each profession based on a typical workplace situation and the demands of the profession. A nurse does the task for nursing, a dentist does the task for dentistry, and so on. What is the structure? The task is to write a letter, usually a referral letter, some alternative letter types, and depending on profession, a letter of transfer, a discharge letter, a letter to advise or inform a patient, carer or group, or a letter responding to a complaint. 5 minutes reading time to read case notes and or other related documentation, and 40 minutes writing time to complete the letter. The writing subtest is designed to evaluate 6 criteria which we will learn about here. Answers for this writing subtest are double marked by qualified assessors using the assessment criteria. Now in writing, the criteria should be carefully read because you need to adhere to these criteria. Most people don't succeed in OET because they come up short in writing. So you have to pay extra attention to the writing criteria. Okay. So the writing criteria basically has 6 things, as you can see here. First is purpose. Purpose helps the reader get a quick and precise sense of what is asked of them. Okay. So what do we mean by this? Due to time constraints, health professionals want to understand the purpose behind a written handover document, for example a referral letter, very quickly and efficiently. This criterion therefore examines how clearly the writing communicates the purpose of the document to the reader. The purpose for writing should be introduced early in the document and then clearly expanded on later, often near the end of the document. The purpose should be easily and immediately identifiable to the reader, so there is no need to search for it. Basically, in the first line of the letter, you should clearly mention what is the purpose of the letter. Next is content. Content considers necessary information. Audience awareness, what does the reader need to know? Considers accuracy of information. The content criterion examines a number of aspects of the content. All key information is included. Information is accurately represented. Audience awareness is key here. The writing needs to be appropriate to the reader and their knowledge of the case and what they need to know to continue care. So basically, content is including everything that is relevant. Conciseness and clarity. Considers irrelevant information. Audience awareness, what doesn't the reader need to know? considers how effectively the case is summarized. Audience awareness, no time is wasted. Health professionals value concise and clear communication. This criterion therefore also considers whether unnecessary information from the notes is included and how distracting this may be to the reader. That is, does this affect clarity? Is there any information that could have been left out? How well the information of the case is summarized and how clearly this summary is presented to the reader. So conciseness and clarity basically talks about the ability of the examinee to exclude things that are irrelevant. Genre and style considers the appropriateness of features such as register and tone to the document's purpose and audience. Referral letters and similar written handover documents need to show awareness of genre by being written in a clinical or factual manner, for example, not including personal feelings and judgments, and awareness of the target reader through using professional register and tone. The use of abbreviations should not be overdone, thereby assuming common prior knowledge. If written to a medical colleague in a similar discipline, then judicious use of abbreviations and technical terms would be entirely appropriate. But if the medical colleague was in a totally different discipline or a letter was from a specialist to a GP, more explanation and less shorthand would be desirable. If the target readership includes the patient, the information must be worded appropriately, for example, minimizing medical jargon. Now, the fifth criteria is organization and layout. It considers organizational features of the document. Health professionals value documents that are clearly structured so it is easy for them to efficiently retrieve relevant information. This criterion examines how well the document is organized and laid out. It examines whether the paragraphing is appropriate, whether subsections within the document are logically organized, and whether key information is clearly highlighted to the reader so that it is not easily missed. The criterion also considers whether the layout of the document is appropriate. Language considers aspects of language proficiency such as vocabulary, grammar, spelling, punctuation. Health professionals are concerned with linguistic features only to the extent that they facilitate or obstruct retrieval of information. This criterion examines whether the language is accurate, used appropriately, and whether it interferes with reading comprehension or speed. Okay? So writing criteria are very, very important and you need to go through them carefully, but the best way to prepare for writing is by repeatedly practicing. So I have talked about all the different aspects of occupational English test, and as you can see in this video, just by going on the official occupational English test website, you can find all the information related to the test, how to book the test, what the test includes, and how to prepare for it. There is also the official occupational English test YouTube channel where you can find additional resources, and you can even watch some videos where people are practicing or preparing for the test. So I hope you found this video informative. There is an entire playlist on my channel dedicated to preparing for occupational English test, and I am pretty sure you will benefit from them if you check them out. Thank you for watching this video. Take care, bye bye, and please don't forget to be awesome.